Okay, team, while the next photos or images coming up, just want to also connect a little bit ko waio. So here hau no te tai tokero. In the image there, you can see tokero te moana. That's the moana that sustains our hapu. We're going for run up te pū o te wheke. Ko te pū o te wheke tētahi o ngā maunga o tā mātou hapu, along with maunga taniwha. We come from the hapu of whānau moana me Ngāti Tara, from the iwi of Ngāti Kahu. In connecting to this webinar, also just sharing a bit around my background in physical activity and nutrition. I've been really fortunate to learn both in mainstream worlds through Sport Waikato. For probably about 6 years I worked at Sport Waikato in those early Māori physical activity roles in health, and then moved home to Te Hauora Te Huku in Kaitaia for about 6 years, working in Māori physical activity under Kore Kore a Iwi, and also have had the chance to grow and learn in academic worlds and now in Toi Tangata. But I think my homeness and that learning within your own communities is absolutely gold. So we're going to explore a bit about that today. So I think Kariata put up around a poll. So I was just wondering if you could take the poll. The first one is around what's your understanding of public health or health promotion on a scale of 1 to 5. So if you could go and have a look, find that and see if you could be a tutu and push the button. Hariata, would we be able to see the results of that?
You should be able to see it.
Sure.
Can you see it now?
Okay, so let's go. Yep.
Awesome.
So team, if you have a go from 1 being not much knowledge, pia, through to number 5 being tino matatou, what's your knowledge of public health and health promotion?
Awesome. People are connecting in. So 80% of people have voted, and
Yep.
40% of people have said it's a 4 out of 5, 40% have said it's a 3 out of 5, and 20%, so I think that's one person has said it's a 1 out of 5.
Ka pai team, that's awesome, because that means that there's lots of knowledge that you guys might be able to share with us all. Let's go to the next poll. How many of you implement public health or health promotion into your approaches of mahi? No, that wasn't the question, eh? Is it?
No.
I can't see the question. Hariata. Oh, yeah. Do you integrate public health or health promotion approaches into your work?
Yeah, that was the one.
Yes.
So it's a 60-40 split. 60% said yes and 40% said no.
Ka pai. That's cool. That's awesome to be able to get a gauge of where people are at. If we can go back to the
So we've done this one, this poll,
okay.
the next poll. So this one, what is public health? Ka pai?
Yep, can't see it, but yep, ka pai.
It's coming, it's coming.
Okay, I suppose when you think of public health, the easiest way that I look at it is that, you know, we move from a lens, a lot of us work with one-on-one with individuals in terms of supporting their oranga. A lot of the times when we're working with individuals, it's around issues of disease or working to prevent disease. Public health is when we start lifting the lens to see how do we support the oranga of the whole community or the whole population. So this definition here, public health, refers to all the organised measures to prevent disease, promote health and prolong life among a population as a whole. And of course, if you start lifting a lens to health approaches to a whole population, there's another layer of skills needed or another layer of approaches to improve the oranga of a whole population. Toi Tangata is an organisation that has a national role in public health and Māori nutrition and physical activity. So we have a role around how do we improve or how do we support development of nutrition and physical activity amongst Māori across the country. Going to the next one. Health promotion is one element within public health. And the example or the definition that I've put up today is come from the Health, from Health Promotion Forum. So health promotion being both a discipline or a type of role, as well as a process to improve oranga, focuses on empowering people and communities to take control of their health and well-being, ranging from action at a community level to developing policies, and it's founded on the principle that health and well-being begins in the settings of everyday life. So that's taken from Health Promotion Forum of New Zealand. For those who haven't checked in before with Health Promotion Forum, their website, which I'll put it up later on, has got a great number of resources around health promotion. Also, the Public Health Association of New Zealand is another national forum that contributes in leadership in public health. For the other element, just thinking health promotion, does anyone know what is another discipline within public health? Health promotion's one. Anyone know what might be an example of another discipline? Is there any way I can ask questions?
People can hear you. Some people aren't talking on the written form yet.
Team, so another example would be health protection. So in DHBs you would have a health promotion team and you often have a health protection team. The health protection are the ones that do the assessment and monitoring of different health issues. So they're the team that will go out and monitor waterways, for example, and see what is the oranga or the quality of the water. So that is another element of public health. In terms of health promotion, a lot of you may be familiar with the Ottawa Charter. The Ottawa Charter was established in 1986 through the World Health Organization, and that's probably one of those key foundation documents that has supported health promotion approaches. You might remember or have heard of those kupu enable, around achieving equity, mediation or advocacy. Those are three key principles of Ottawa Charter. And a lot of our health promotion contracts in the past have been developed or written around the health of Ottawa Charter. Kupu you might also be aware of is around community action, so creating supportive environments, supporting healthy public policy, developing personal skills, and also there was a big development around reorientating health services to collectively work towards health issues. While we're not going to kōrero so much today around the Ottawa Charter, I just want to bring it up because it was part of the journey towards Te Pae Mahutonga, which is what we're going to talk about today. And switch. So, Mason Durie wrote and led Te Pae Mahutonga in 1999. And Te Pae Mahutonga was something that he acknowledges comes from the development of Untitled Chapter, but also the MAHI led back in 1901, I think, around Maui Pomare's work. Dr. Maui Pomare and his approaches in that time to oranga was based around leadership. He recognised that one, he had his own leadership as a doctor coming back to contribute to skills to his community, but he also valued the leadership in communities. His approach to oranga at that time was also around, you can't just look at the disease, you have to look at the environments that the disease is happening in and taking that into consideration. He recognised that he needed to build skilled workforce to support. There was a whole lot of things that Dr. Maui Pomare led, which contributed to Mason Durie's approach in Te Pae Mahutonga. Also, he acknowledges Untitled Chapter and the work that happened over those 20 years. So today we are going to look at Te Pae Mahutonga. I thought it was important too because a lot of our work in today's, even in our sector at the moment, has gone back to working with individuals, and it's been quite individual focused, and making sure that we take time out to think about what are those other layers of approaches that we could be implementing in our mahi to ensure that the benefits can be brought across the whole population. So Te Pae Mahutonga, as you realise, Southern Cross, and for our tupuna, the Southern Cross is a navigational tool and help provide us direction. In this space, the Southern Cross, there are four key tasks which they talk about, which we'll go through: Māori ora, cultural identity, te oranga, participation in society, toi ora, healthy lifestyles, and wai ora, physical environment. Those tasks can't happen in isolation, so it acknowledges the pointer stars, te mana whakahaere, which is autonomy, and ngā manukura, community leadership. So we're going to have a look at each of these elements, and I'm just going to share an example of how I may have integrated that into practice over the past few years, but I'm more keen to hear about your guys' ideas and see how we can do that on a webinar forum. So if we start in the first one. Is it coming over?
This one?
Yes, please. Ka pai. I can just bring up all the points. So the first star in there is around Māori ora and access to te ao Māori. A key part being that recognising that our identity as Māori is critical to our oranga, and it's also critical in terms of Indigenous people across the globe. So a key element of Māori ora is ensuring that within your health promotion approaches or within your approaches to oranga, how are we ensuring that there's access to language and knowledge? How are we supporting whānau's connection back to those cultural institutes, such as marae, such as pea, maybe whare karakia, access to those whenua, the spaces? How do we ensure whānau have access to resources that are out there, and also being able to access spaces and places where being Māori is celebrated. For us, I think there's lots of the team here within I'm just checking in who's on. Ka pai. A lot of the team within this session are all linking in access to te ao Māori within your delivery. And that's grown heaps even just in the past 10 years to be able to integrate te reo and our mātauranga back into our mahi. When I think of this space though, I also think about, in terms of physical activity, how are we also supporting access of whānau to the right equipment? So we may be building more whānau getting on bikes, and we might be starting to have the weekly cycle ride. What are the layers in your mahi that you are doing to then ensure that whānau have access to the right bikes. In a way, there's a bit of inequality starting with sometimes there's with the bringing back of Iron Māori. At those early years, there was still 10 speeds and that old school bikes in those first years of Iron Māori. When you go there now, the type and quality of bikes are flash as, which is awesome in terms of an increase of whānau participating in using those resources, but does that start then creating inequities for whānau just starting off to access that type of bike? Just simple things, even in terms of access to healthy kai. If we're going to say no to fizzy drinks and no to any of those sugary beverages in a shop, what are the other opportunities for whānau to access? I think the example that I have up there, I just highlighted, if you can swap to the next one, Hariata, just highlighted our image through our atua matua wānanga, which have been led with Dr. Hirangi Heke across the country. This is an image from Kaikohe, I think last year, might even been the year before, in terms of Māori ora and the value of connecting to these whenua, connecting to kaumātua who are able to share mātauranga. Whanaungatanga, physical activity is just really the byproduct that happens from those haerenga. The absolute gold is when whānau are getting to connect back to these spaces and connect back to the mātauranga and knowledge and stories. But what I'd be really keen to hear from you guys, are you able to share some of the ways that you're integrating access to Te Ao Māori into your mahi?
Kōrero mai, guys. Feel free to open up at this time. So for most of you, that also means you have to turn your mic back on.
Kia ora whānau, Kanan, Tuhura from Popataki, Te Roa. So yeah, just thought I'd share some of the mahi that we do here at Popataki. Most of our mahi is based on Te Roa mātauranga or Te Roa tikanga and kawa. And all our programs are pretty much based around re-engaging or reconnecting our whānau with their Te Aroatanga. So we do a lot of hikoi, bike rides, hoi as well, where we go out and like Callie said, we do these physical acts like walking maunga, pedalling on our awa and roto, but that's just a byproduct of our whānau that are coming along to learn more about their culture and their identity.
That's awesome, Kanan. Thanks for sharing that. And just a big mihi to you and your rōpū at Te Papatakoro, because a lot of the mahi that you guys have been leading has led the way for a lot of us to be rethinking and reshaping our approaches in our own mahi. So yeah, ngā mihi. Anyone else got any examples of how they're integrating it within their work?
Open up the discussion documents. I can't get it on.
Ka pai. We'll carry on then. So the next element, so the first whetū was around Māori ora. The next element is, if we can swap to the next page, Hariata, is wai ora. And whereas Māori ora is looking more around that internal strength, vitality and secure identity, wai ora is more the external world and reconnecting us to our environment. So all of those elements there that recognise that our oranga as a people can't be disconnected from our interaction with our environment. So the elements, these 5 points that are within Te Pae Mahutonga is that our water is free of pollutants, that we can access clean air, that our earth is abundant in vegetation, noise levels are compatible, and opportunities are created for people to experience natural environment. Key thing for us, water is free of pollutants. That's going to become more and more a critical part of our oranga moving ahead. And I suppose it's a key as we are looking for strategies to increase drinking water as a choice opposed to fizzy drinks or any of those other types of inu. How are we also ensuring that our waterways are being looked after, and that is an element of our innovation or our approaches in our work. The one around noise levels are compatible is I'm just thinking how awesome is right now. I am in the far north and pretty much it's quiet as compared to when you're in the city, and recognising the impact of that noise level on our oranga. Key thing of which again we've already talked about is being able to create opportunities for whānau to experience a natural environment, taking whānau back to connecting into our maunga, into the ngahere, out to the sea, that we are looking for those opportunities within our work. Just thinking though, again, in our mahi, it's that role of the environment and recognising how that impacts on our choices in nutrition and physical activity. So examples again could be in your environment, there might be you and your community a whole lot of more takeaways. What are we doing to support having more healthy food opportunities within your community? We were talking the other day, I was just down the road from me is Whatuwhiwhi. We've got a petrol station and I think there's a takeaway shop. That's about all there is. So the opportunity to be able to work with the environment in those shops to take out V as a start would mean, that whole community in the peninsula wouldn't be able to go and purchase that type of drink. So making sure if we're trying to increase walking, what are the tracks, the access within your own environment? As we're building opportunities around mountain biking, what are the things that you're doing to start helping support the trails to help whānau to connect to different places of mātauranga of influence? Just going to the next page, Hariata.
This one?
Thank you. That's the one. So that was just highlighting in terms of environmental protection, waiariki is approach Toi Tangata is leading around water and valuing the mauri of wai. Recognising that, again, as I've been saying, if we are going to be addressing sugar beverages across the country, we also have to be acknowledging why, rechanging our language in terms of why, how te kupu hariata, kare
He hare te wairika.
he waihoka.
He waihoka.
Ai. Which is again rephrasing our language and our reo, but also, a whole lot of strategies within there. Keen to hear though, team, is there any work that anyone has been doing around waiora and around elements of the environment to support physical activity or nutrition? Has anyone done any work with councils to support any of the facilities or access to facilities in your communities?
Right, anyone? I don't know if my mic's on.
Yep, whoever that is, yep, your mic's on.
Oh, kia ora Kelly, is Anuru here. When
Kia
you
ora,
can
Anuru.
hear me. In the past, I have worked with council around in health promotion as well around using around the dental using the fluoride in the water.
Oh, yeah.
So in water they had the council was wanting to support putting fluoride in the water. So there was a big thing to move around that, having fluoride in the water in Wairau. So,
Hi.
and the thing behind it was apparently it's meant to be good for your teeth. So for us as because I was part of the dental as well, and I was a bit sceptical on how having fluoride in the water as well, being part of the dental team. So yeah, I think one of the iwis didn't want it to happen. So that's why it never got pushed. So we were part of that. I was part of that side of things, not getting it pushed, getting fluoride in the water.
That's an awesome example, Anaru, and it's one of those things. So in terms of fluoride in the water, that could then support a whole population to maybe reduce dental cavities.
Yeah.
But then on the flip side, it's that wero around how does that impact on the Māori and why.
Yeah. So that was an off-guard around it.
And those are those challenges we have too, I think, in health promotion around mātauranga Māori and mātauranga Pākehā in these spaces.
Kia ora, Callie, can you hear me?
Yep. Kia ora.
Moana here. Kia ora, everyone. We're in the process of getting together with the council around our local swimming pool, our public swimming pool. The reason being that we've got a lot of people travelling over to Whakatane, which is about 40 minutes away from where we are, accessing the pools in order to do training and do aqua aerobics over there. So we're looking at getting together with the council and getting people from different sectors throughout our community to get together and say, hey, why don't we put a roof over our pool so more whānau here can access our pools here, and that'll be more money coming back into our community. So that's one of the projects we're going to be putting into place this year.
Wow, awesome, Mo. That's a great kaupapa. And I think in those ones, in terms of that, some of those simple changes, which still take a long time, like putting on a roof and getting more whānau to be able to access, can make such a big change to, whānau's ability to be physically active.
Because one of the things that we put out there was, you can say, like, first of all, do we need it? And I think the biggest cry from our whānau here, yes, we do need one. Because you think of people about challenges in regards to transport and everything like that, that would address those challenges that a lot of our whānau have, and money-wise too.
Aye, awesome. Awesome, mate. And I'll share a bit later on one of the process that we've taken up here in the past few years around a similar type of kaupapa.
Awesome.
Team, so if we...
Leanne had a bit of a comment as well. She uses the question pane. So I'll just read out what she said. Our council have just finally returned the ancestral awaho to rangi wehi wehi iwi, and it will inevitably improve the mauri of the iwi. It's huge in terms of Māori health. The awa is the place we go to karakia and whakairi tohi awamea. So that was from Leanne.
Ngā mihi, Leanne. That's awesome. And it definitely is a space when it takes a lot more energy, I think, to work in that space around waiora, but the benefits can be huge. Team, I'm just going to go on to the next one around Toi Roa. Toi Roa is one of the third of the 4 stars, Whetū. It's probably the one that we're all the most comfortable in, the one that we know the most, and that's all the area around healthy lifestyles. It's a space that connects to, in the model, that connects a lot more to personal behaviours, but also recognising that we don't all have the same choices regarding our avoidance of risk. So a lot of the kaupapa around Toi Roa is around risk recognising that we live in risk-laden environments, Pia. I don't know if I like the kupu or the way that's phrased, but all of those approaches that can look at harm minimisation, such as you know, the work that's done in those communities when you have 10 alcohol shops selling alcohol in a small community. Those approaches to then how do you reduce the minimisation of those shops, for example. It's all of the interventions that we'd be doing around addressing obesity, around what Anaru was talking about, addressing dental health. I think a key element of this which has evolved and we're hearing more and more is those last 2 points around cultural relevance, ensuring that it is relevant for us. Wherever we are, not only relevant as Māori, but relevant for us as Māori at the East Coast or us as Māori in Taitokiro, and that we are coming from those lenses more and more from a positive approach. And even in the past 5 years, we are hearing a change of language of rather than talking about diabetes and talking about our poor health stats, moving it to becoming around what's the strength within communities. This is one I won't talk lots about because I do think it's a space that a lot of our work is directed in. I'll just put up one. I just put up a photo. What did I put up a photo of? A bit of click, Kariata. Oh, look, team, I was just putting a photo of us as Muri Whenua up. Those were one of the early days at Iron Māori. We're really fortunate. I think the very first year we had about 60 whānau came down from the far north to Iron Māori. And a key part of that is around Toi Roa, but also there was all the other journey elements around how did we get people, like we were saying before, how did you actually get people to get on bikes? How do you get access to those resources? Finding wetsuits, let alone getting us to be able to ride on the roads where you've got logging trucks coming past you at 100 kilometres an hour. But anyway, I'm going to move on for that, but I just wanted to put a cool photo of us up north, especially because I'm home this week. Okay, yep, next one, thank you. The final star of those 4 whetū is te oranga, participation in society, and again it is, it's a key element. I didn't spell that right, eh? Participation, no, aroha my team. Te oranga is around ensuring that whānau have an opportunity to participate in the decision making of innovation. It's too often, I think, I don't know. We're in positions of we are lucky that we have roles that can influence decision making. How often are we actually engaging in communities to support the development of innovation? And it's the stuff that you're talking about, Mo, like in terms of the role of swimming pools. How do we ensure that communities have access to that process? How do we ensure that, like Anaru's talking, that whānau have contribute to those policies that are put forward to government around fluoride in water? Probably the biggest point of this one is I will talk through with the image that's on next, Hariata.
Mm-hmm.
Is it coming up?
Parkdale Reserve, Kotai, yep.
Yep. Team, this is probably one of the best examples that I've been fortunate to be in that supports that participation. And it was that thing where you come back from conferences and you're all excited and you think, sure, yep, I'm going to go and start putting in marakai and community gardens and all these things. And when we actually went to the community in Kaitaia, the very first photo up on the left-hand side highlighted, well, actually this community had a huge park, but all they had in that whole paddock was one swing frame with no swing. And then if you can see up the back behind that, over 2/3 of the park's lawns actually were that long grass, and this is a council managed, owned park. So it was one of those first learnings to me up home around, well, actually, Callie, no, your idea might be true, but it's not actually the highest priority. The highest priority is actually how do we ensure that the communities have access to parks that are well maintained, and that they have access to resources in their parks just like any other community, so these tamariki can play. Our approach at that time was, well, how do we get whānau to participate who might not normally have had access to a say? And so we just put up in the park, we had a barbecue going, so we had access to whānau had a kai. There's your move that pulls whānau in. And while we were there, we had activities for the tamariki. The parents came along to have a nohi. While we were there, we maximised the opportunity to, well, what are your needs? What would you like for this park? How do we, and then from that we were able to write up submissions to the council for the long-term council plans. Simple things again in that bottom photo is just making sure that we had a tent in the park for a number of weeks so that whānau could come in and we helped them write in the submissions. There were whānau who were actually leading from that community, who were the most effective movers and shakers. They were the ones that went and got all of the up and down the road to get submissions. We ended up in that project having, I can't remember the number, but it was the highest number of submissions to the Whānau District Council that year. And we were able to actually access about $60,000 to a development over a number of years for that park, which included a full-size basketball court, that the lawns were mowed, that was the main thing, that we had access to a park. Originally though, you got to laugh, we got a second-hand park from Kirikiri, which we had to go and build ourselves, but pai ana, because even in that process, the whanaungatanga, there's the engagement of whānau, and eventually we did get a brand new one. None of that would have happened if, as a kaimahi, I had gone in with ideas which I thought were valuable, and we hadn't have provided a platform for whānau to be able to provide their own ideas. And the wera was more for us to maximise our skill set of knowing how to write stuff or being able to advocate at different points, rather than being the ones with the ideas. The other thing, I suppose, in terms of participation is that how do we ensure that every opportunity we have, that we're supporting other whānau to come and participate too. So for those types of things, whenever we presented at conferences, or if we presented anywhere, we ensured that whānau from that community came along with us and had the chance to participate. Yeah, that was good learning in terms of, again, not being about what we think is a kaimahi, but also ensuring if you do give those platforms, then awesome mahi can happen. So Team Yo, really keen to hear, how do you engage or connect community into your innovations? Or even sharing what approaches have worked when you've tried to engage whānau, or even what hasn't worked, because sometimes those are the best learnings too. Okay, then Mo, gonna check in with you. Mo, with the kaupapa that you're leading around the awesome idea around connecting with the swimming pool, what are the ways that your team or the people have been thinking about engaging whānau?
It goes back to what you were saying. Whānau need to be on the developing stages right from the beginning. We can have the flashes ideas about saying we want a board here, but it's going to have to be something that they want. So we had a hui with various whānau, and as you said, yeah, who are the shakers and movers of this community that would support the kaupapa? So we got them on board, and like what you were saying, we had this lady, she's in her, I think she's 80 this year, one of our queer, going around up and down the street, getting people to sign the petition, sign it or else, nah, you know, things like that. Yeah, so it's really important that right from the beginning stages that we have the whānau on board to support us. Otherwise, it just ends up being a flash idea that's not going to happen.
Ai, tautoko.
Mm.
Awesome,
And
Mo.
so, yeah. The next stage from there now is to invite those from the representative from the district council, and also bringing our marae on board, our various marae throughout our rōpū to come on board as well, and invite them to our hui. And this is where we are, this is what we want. Where do we go to from here? Kia ora.
Kia ora, Mo, that's awesome. I know one of the things that really helped us in that process, which is again around the whanaungatanga and who you know, is finding out in the council what are those time frames or what are those opportunities where you can advocate in wero. We were just lucky to have whānau who was working in the council at that time who knew what the process was to access that long-term council plan. And some of you might have those whānau within or just people you know within those organisations that can make a big help too.
Yeah, we have got a person that's a member of the council, and she's a real keen swimmer, and she's really keen to come on. Tautoko. So yeah, cool.
Awesome. Okay, team, we've got 2 more points. I see we're nearly at 12 o'clock. Two more key. So the first 4 that we talked about are those elements or tasks. None of those work, or nothing can happen really in health promotion without these 2 pointer stars. One we have talked about throughout this is around leadership. That you need to have, leadership is not necessarily from us who have roles within a hauora, although, we still have a key role in place within health promotion. Needs to have community leadership, health leadership, tribal leadership. There needs to be sharp communication happening, and you need to be starting to connect different groups together to make innovation happen. One of the things when I was reading up some of this work, which I thought was a really cool point from Mason Durie, was that we have important roles as health providers or health kaimahi in hauora, but we can't replace leadership in communities. And I think it's something that it's a tenuous line when you have access to resources and that within your workplace, but really trying to find those movers and shakers because having them on board will ensure that it's sustainable once our contracts disappear and a new kaupapa comes along. The elements, it's talked about a lot around the alliances between leaders and groups, making sure we are thinking of who are those other groups that we can be pulling in. Nowadays, whereas in the past, a lot of our conversations we're trying to just get different health providers together. Alliances now are within different sectors, within other areas such as how we're connecting in the kura, education. How do we connect in those from in different social services sectors? Who are those other businesses within your communities who could be supporting or have a role to contribute? Overall though, yeah, I think in this space, valuing movers and shakers, and yeah, just reflecting and rethinking about what our role is leadership in these innovations. Can you just push the next button, please, Hariata? Are you there, Hariata?
Yep, I pushed it.
Is
Of
anyone,
whānau on a beach.
can anyone see the next space, the next slide?
Yep, whānau. They're on the beach.
Whānau on the beach.
What's the picture of?
Whānau on a beach.
Doing
Hands on shoulders, in a
Okay.
line.
Okay, I can ka pai. Awesome team. Whānau on the beach. Sure, that's Te Pae Beach, and I think it's really again just highlighting in our roles who are we building those opportunities for. How do we ensure? Likewise with the Toi Roa training. Next. Okay, I can't see it, but pai ana. How do we ensure that you're growing others in your community while in your roles? How do we ensure the next Toi Roa, if there's a kaimahi coming, that you have two other people from community and they're having the opportunity to grow their leadership in the space? How do we, I suppose for us an example would also be the student internships, which we've now got up at the moment. We've had 3 years having those opportunities for those students coming through to experience public health, Māori public health, nutrition and physical activity, which then gets us people like Hariata, who was one of those initial students that came through that pathway. But just reflecting and making sure we are bringing along others with us. Okay, last point. And is it come up, Hariata?
Yep.
Right.
Can people see it?
Right.
Oh, it must be just me. Okay, aroha my team, I can't see it, but I think the last point up there is Hea te ingoa, what's the title?
Economy.
It's around
Autonomy.
te mana whakahaere, around autonomy. And it's an element that I've heard people talking about already, and that kōrero around, you have to have community ownership. There has to be a sense of tino rangatiratanga in the innovations that we're aligning. We have to recognise that it's not about our aspirations, it's about the aspirations of those whānau groups, communities that we're working with. Recognising though that many of us are still have a pōtai as a whānau in our community, so our aspirations do count too. There is that element of, again, that fine line that as health workers we don't assert strong leadership, that the community autonomy might be undermined, and trying to ensure that community autonomy is there, that our processes are ensuring that, as we've talked about, whānau or communities or whoever we're working with are integrated and part of that journey. Measures is an interesting one, because often as kaimahi we've been pre-given measures based on our contracts, but ensuring that our measures still work with what whānau want and where they're at. And I suppose it's that learning, so that if things don't happen overnight, all of us know that it's, it can take years before it might be 4 years before the pool's happening with Mo. It might, it takes a long time, but if we were to walk away as kaimahi, those innovations are still continuing and whānau are still being physically active or making those changes. The other point, I suppose, is around those relevant processes is ensuring, like, even language. There's no point in having the Flashes Days campaign if the language or the style of it is not aligned with the communities we're working with. All of those elements come under autonomy or te mana whakahaere. The key example I've got up there, I think the next one, Hariata, is a photo of the profiles. A lot of whānau might recognise or have been part of One Heart Many Lives over the last few years. especially when it was highly promoted. The profiles was an approach that we had up here in Taitokero, and that was probably one of my first lessons of, or another one of those lessons around it's not our ideas as kaimahi, it's about what whānau wants. And so those are some of the first tāne that actually developed and led our One Heart Many Lives campaign up here in Taitokero. Those same, and I was actually pretty fortunate as a wahine to be in the room when they would have the focus groups that were led at that time by Lance, Dr. Lance O'Sullivan, and Nare Anderson, and Lisa and I, Lisa McNabb was my boss at the time, and we were in the room in the focus group, but we couldn't really have a say because it wasn't our kaupapa. But we were really fortunate to be in the room to listen to tāne's ideas, simple things again around the language of how a doctor communicates heart health, and why can't we just have resources that understand, yes, my risk of heart disease is a red lighter, an orange lighter, or a green lighter. And those ideas helped develop the type of resources we had. It helped develop the communication, and it ensured that faces from our own community were the ones that were leading and communicating the kaupapa of oranga through heart health. I always remember and just acknowledge Matua Makware and Matua Rapine, two of the tāne in there have since passed away, and they were the profiles, they were the red lighters, had a high risk of heart disease at that time, but their ability as red lighters to wero and communicate to those bros who were orange lighters was just far greater than anything anyone else could say. So they were able to communicate to other tāne around, make changes now before you become a red lighter. So just ensuring whānau have that opportunity, and just recognising the value of how awesome, when the right platforms are provided, how awesome the journey can be. So Team 1205, just really thinking in what are some of the elements of your mahi that you could strengthen through adding layers of Te Pae Mahutonga and those elements of health promotion into your work. Yeah, so just any other comments, team, or any things you've thought about through that else you'd like to share?
Just tracking back from before, Callie, with your previous discussion point, Leanne had a comment that I didn't quite get to mention before you moved on, so I'll just read it out now. She was talking about events when you were tracking back to that park in Kaitaia, and her comment was, hosting whānau free events. I found the best learning came from a series of events that we held at cost of our organisation's pocket, but we learned that our community wanted fun, inclusive events, and they included colour blasts, glitter wars, and water fun events. They were the best learnings for us. That was from Leanne.
Awesome, Leanne. That's cool. And in reality, sometimes those events, even though the cost to a provider aren't really as huge of cost as the cost it would to be going lead hui to get all of the feedback, or the benefits are huge sometimes from those. Has anyone thought, is there anyone who's had any ideas through this webinar about what they might contribute or change or adapt into their own work, current work? Ka pai team, then that might be us for today. Hopefully it's just helping to maybe reaffirm your approaches that you're already leading in your work in health promotion, or opportunity to learn some other elements of health promotion approaches. I will put up, or I'll get sent out some of the different readings that you could go to, or definitely the two organisations in New Zealand, Health Promotion Forum or Public Health Association, lead a lot of work around in public health and health promotion. Be great for you to connect into.